Hello everyone, welcome to my YouTube channel Make MBBS Easy. This video is about the last part of histopathology slides, that is part 5. It includes malignant tumor which are hematoxylin and eosine stained. The first is adenocarcinoma of intestine. Here you can see the microanatomy of the intestine which are ordered due to malignancy. Now I am going to describe it. There are complex and abnormal gland formation due to neoplastic changes. The typical neoplastic cells are seen here with varying degree of anaplasia. The anaplasia is indicated by the nuclear and cellular pleomorphism. The cells are disorganized, crowded due to overproduction, have vesicular nuclei, and abnormal mitosis are also seen. The neoplastic cell invade the stroma and deeper tissue, breaching the basement membrane. Here you can see the abnormal glands. The next is Scirrhous carcinoma, which is a type of invasive ductal carcinoma in breast tissue. That is the slide. The dense fibrous stroma is seen here, which are generally hyalinized and infiltrated by the malignant cells, especially the lining duct. And the malignant cells also disposed in cords. Solid cell nests are formed, tubules and small glands. Infiltration occurs here. Also in the anastomizing mass. The natural characteristics of the neoplastic cells are seen here. That is, the cells are large, pleomorphic, irregularly arranged and hyperchromatic nuclei with occasionally mitotic changes. Here this slide of invasive ductal carcinoma. Specifically we can say Scirrhous carcinoma. The next is renal cell carcinoma. Here in this slide you can see a glomerulus and the altered microanatomy of the renal tissue due to malignant changes. The points to be noted here are compressed renal tissue, cells arranged in nests, sheets, cords in a tubular pattern with intervening vessels. The characteristics neoplasmic cells are seen here, which are large, polygonal, clear cytoplasm, hyperchromatic nuclei. Sometimes pink granular cytoplasm are also seen in the cells, and occasional hemorrhage and necrosis are observed in renal tissue. This is a histology of renal cell carcinoma. Now let's move on to the next slide, which is Seminoma. Have a look at this slide. There are numerous malignant cells, small, haphazardly arranged with clear cytoplasm and densely stained nucleus. The following points to be noted: large monomorphic polygonal cells with clear cytoplasm. Nucleus is large, vesicular, rounded and central in position. The nucleus is large enough in comparison to the cytoplasm. The cell divided into cluster or lobules by fine fibrous septa. Septa is also infiltrated by small lymphocytes. All small cell proliferating in the slides you can see are the malignant cells. The next is metastatic lymph node. It's specifically metastasis of the squamous cell carcinoma. Here the capsule subcapsular sinus is not clearly seen in this slide, but microanatomy of the lymph node is near about clear. Now come to the points of metastatic lymph node in case of squamous cell carcinoma. The as usual lymph node histology, that is the capsule subcapsular sinus, is seen. In this slide it is not so clear as well. And the second point is some places cluster of pleomorphic squamous cell irregularly arranged hyperchromatic nuclei are seen. The characteristic features of the neoplasmic cell and the presence of keratin pools also seen here. Here you can see the cells with clear cytoplasm and dense nuclei scattered everywhere are the neoplastic cells. The next is melanocarcinoma or malignant melanoma. Here at the 6 o'clock position and 10 o'clock position you can see the melanin deposition in the tissue. Though the structure of the skin is not so much clearly appreciated here. Now come to the points. In the section you can see the skin with polygonal cells with mitotic bodies. Characteristic features of the neoplastic cells. Cells with pleomorphic vascular nucleus and prominent nucleoli. Cytoplasm containing brown pigment, and brown pigment may be seen extracellularly. Here you can easily see that the brown pigmentation which occurs intra as well as extracellularly. That's all about melanocarcinoma. And next is basal cell carcinoma. This is a slide showing you the basal cell carcinoma. I am going to describe it. This showing the structure of the skin with the club-shaped masses projected downwards into the dermis. The club-shaped masses are actually proliferating basal cells, neoplasmic cells, and the outer layer of the cell clump formed by the single layer of columnar cell in palisading arrangement. At margins they are stained deeply with hematoxylin stain, and the central of the mass is formed mainly by the neoplastic or tumor cells. They are small and haphazardly arranged and basophilic in nature and fusiform in structure. Here you can see the central neoplasmic haphazardly arranged cell and the outer columnar cells, and there is dermis which are embedded by these structures. And the next is osteosarcoma. This is a slide showing you osteosarcoma. Now I am going to discuss it. That is less like homogeneous pink streaks of osteoid tissue as seen in the slide with malignant cells. Malignant cells with their usual characteristic, that is scattered, dark stained, pleomorphic, oval and elongated, and multinucleated giant cells and hemorrhagic areas are also seen in many cases. This is the slide showing osteosarcoma. That's all. Thanks for watching.